We're with Dr. Wigoda discussing celebrity plastic surgery. Hi, Dr. Wigoda.
Hello.
How are you today?
Good.
Thanks. Good. Okay, let's talk about Sylvester Stallone, Rocky, the people's champ. He's getting up there in years, but it looks like he's had a little bit of work done. Why don't we quickly take a look at some pictures of Sylvester as the years go by?
What's interesting about Sylvester Stallone is there are times where I've seen him on TV where he looks great, and there are times where I see him where he looks definitely like he's had too much plastic surgery. If we look at him when he was younger, this is from the original Rocky movie, he's a good-looking guy. He's got a nice, strong V-shaped jawline. His nose is straight. He doesn't have any wrinkles, which you wouldn't expect. He's probably in his early 30s here. There's no bags under his eyes. You know, he's a young, good-looking guy. If we then look at the next picture that we have, which I think was taken a couple of years ago, so he's now probably about 60 years old. Still a good-looking guy. It looks like he's probably had a facelift by now. If you look at his jawline, he has a nice jawline, which you wouldn't really expect at this age unless you have some surgery. His nose is crooked. I'm sure he's broken it with all the action movies that he's done. It doesn't look like it was fixed, or it wasn't fixed completely. It's got some wrinkling around the eyes with some crow's feet. Again, I'm guessing by this time he's had his eyes done, he's had a facelift, and overall it looks pretty good. If you look at his forehead, there's very few wrinkles, which suggests he probably had Botox. So he's probably had Botox throughout the forehead and the crow's feet. He's had a facelift, and I'd say overall in this picture he looks pretty good. We then go to the next picture, and this might be a little bit of an unfair picture to really look at, because sometimes when you take pictures of people and they're sort of making a funny expression, it makes them look a little bit unusual. In this case, it could be that his chin is kind of going back if he's grinning or laughing. But if you look at his eyes, looks like there's more crow's feet than there was a couple of years ago. He's got a deep crease in his forehead, which means he needs to go get his Botox done. Again, his nose is fairly crooked. His lip looks a little bit strange, but again, that could just be this particular photograph where the lip might be kind of caught up in the teeth. He also looks a little bit heavier in this picture, and I think his weight probably fluctuates. You know, when he's doing an action movie, he gets in good shape and his face thins out, and when he's not, he probably gains some weight. And this picture looks like he's in his heavier stage. And that's about it.
And Dr. Wigoda, if Sly was your patient, is there anything you would recommend to him right now?
Well, I think he's due for some Botox based on this last picture. I talked to him about straightening his nose out. It's definitely on the crooked side. And then he might be able to benefit from a filler in the nasolabial fold area. And again, based on this picture, it's hard to say whether a facelift again would be a benefit to him, but I'd probably lay off of the surgery for now. In some pictures or television shows, he does look like he's a little bit overdone.
Okay, well, thanks a lot, Dr. Wigoda. We'll see you next time.
Okay, thanks.
Thank you.